Welcome students to the screencast on Lecture 7, Middle and Late Childhood, Physical, Cognitive and Socio-Emotional Development. The focus today would be mainly on middle childhood and cognitive development, though we will spend some time looking at physical and socio-emotional development. Middle and late childhood is the period of life between 6 to 12 years when children attend school, are making friends outside the immediate family, they master new physical and mental skills and are becoming more and more of an individual. However, this opens the door for a new set of challenges, both for the child and the parent, and often can lead to stressful situations that can have a negative impact on the child's development. So to begin the class, let's just look at the learning outcomes. At the end of the session, students will be able to describe physical, cognitive, and socio-emotional development during middle and late childhood, to compare and contrast physical and socio-emotional development during those years, to differentiate between the pre-operational and concrete operational stages, to describe what Piaget calls horizontal décalage, and to distinguish between self-esteem and self-concept with regards to middle and late childhood. So let's begin to look at physical development during those years. So children grow more slowly during middle childhood, but at a smooth rate and become more skilled in controlling their bodies. So growth averages 2 to 3 inches per year, and weight gain averages 5 to 7 pounds each year. Muscle mass and strength gradually increase and baby fat decreases. Head circumference and waist circumference decrease in relation to body height in middle and late childhood. Bones continue to ossify during those years, but yield to pressure and pull more than mature bones. So what is happening to the brain during that time? The brain of young children appears to be organized differently from that of adults, and we all know that. The brain volume stabilizes, there are significant changes in specific brain structures and regions, especially in the prefrontal cortex. There are increases in cortical thickness, activation of some brain areas increase while others tend to decrease. In terms of motor development, motor skills become smoother, more coordinated. Improvement of fine motor skills like even buttoning a shirt, tying your shoelaces during those years due to increased myelination of the central nervous system. So there is improvement of the fine motor skills. Boys generally outperform girls in large muscle activities, yet girls usually outperform boys on the fine motor skills. So just looking at health, illness, and disease during that time or that period of childhood. And generally, these children are in excellent health during middle and late childhood. This is the period when the children are healthiest, and risks include accidents, obesity, eating disorder. And this is where it starts. Eating disorders begin. Disease and death are less prevalent at this time than other periods in childhood and adolescence. So during middle and late childhood, the most common cause of severe injury and death in this period is really in terms of motor vehicle accidents, either on the pedestrian crossing or as a passenger. In addition to that, there are health concerns. Being overweight, which I'll talk about, which is an increasing health problem. We have about 30%, based on research, 30% of U.S. children are at risk of being overweight, although this level in child obesity has begun to level off recently, though I cannot say the same for Trinidad. We do have a lot of obese and overweight children here in Trinidad. Cardiovascular disease is uncommon in children, but environmental experiences and behaviors in the childhood years can actually sow the seeds for this disease in adulthood. Cancer is known to be the second leading cause of death in the US for children aged 5 to 14 years. So what is happening in terms of exercise for those primary school children? Primary school children, they are far from physical maturity. So they need to be active. They become more fatigued by long periods of sitting than by running, jumping, or bicycling. So physical activities such as batting a ball, skipping a rope, or balancing a beam are important for these children to refine their developing skills. Therefore, it is quite clear that exercise plays a pivotal role in children's growth and development. So television watching has been linked to low activity and obesity in children, playing video games, the tablets, doing all those indoor activities can increase the risk of a child developing obesity. Another related concern is the dramatic increase, of course, in the computer use. Researchers found that the total time watching TV and or being on the computer is directly linked to reduction in physical activities and thus being overweight. So increasing children's exercise levels actually would have positive outcomes in relation to their health as well as cognitive development. Research has showed that aerobic exercise was actually linked to an important cognitive ability, that is planning, among overweight 9-year-olds. So it is important that your children or siblings in that age group exercise, engage in outdoor activities. And if that doesn't permit, in terms of maybe the environment doesn't permit outdoor activities like riding a bike, climbing the trees, what parents can do is to engage the child into some extracurricular activity, enroll them into those activities so that they could, exercise, maybe swimming, maybe football, basketball. These are all the activities that would help that child reduce their risk or that risk for developing any sort of problem later on. So as I move on, let's look at the scope of disabilities. There are other problems that may arise, as you know, during that period, and one of them would be the learning disabilities, difficulty in learning that actually involves understanding or using spoken or written language, and the difficulty can actually appear in terms of listening, thinking, reading, writing, and spelling. Research shows that boys are identified 3 times more frequently than girls, again, to maybe develop a learning disability. And there are 3 main learning disabilities: dyslexia, severe impairment in one's ability to read and spell. I think many persons are familiar with dyslexia in terms of what it is. Dysgraphia involves difficulty in handwriting, make errors in spelling, write very slowly, illegibly. And dyscalculia, known as the developmental arithmetic disorder. It is the developmental arithmetic disorder, difficulty in math computation. So as I move on, let's turn our attention to other forms of disability, more in terms of cognitive problems associated with that age. So some children may show other signs of disability like ADHD, attention deficit hyperactive disorder, which is where children consistently show one or more of these characteristics over a period of time, whether it be inattention, hyperactivity, impulsivity. With inattention, children have difficulty focusing on any one thing that they may get bored with a task after only a few minutes or even seconds. So those with hyperactivity show high levels of physical activity, seeming to be almost constantly in motion, always active. Those who are impulsive have difficulty curbing their reactions. They do not do a good job thinking before they act. And some of the possible causes of ADHD, although it is not confirmed, but genetics have been considered one of the causes: brain damage during prenatal or postnatal development, even cigarette and alcohol exposure during prenatal development. There seems to be a link, and in terms of low birth weight. So let's turn our attention to some of the more emotional behavioral problems and even more psychopathology in terms of childhood. So the other serious problems related to emotional and behavioral disorders become even more evident during that time. Serious persistent problems that involve relationships, aggression, depression, and fears associated with personal or school matters, as well as other inappropriate socio-emotional characteristics. So there's that pervasive developmental disorder that you see in children, is what you see in terms of autism spectrum disorder. And the pervasive developmental disorder that you see, that autism spectrum disorder, these range from the severe disorder labeled autistic disorder to a milder disorder of what was formerly called Asperger's syndrome. So Asperger's syndrome is no longer a disorder under the DSM-5, that Diagnostic Statistical Manual of Mental Disorders, but it is now incorporated as part of the autism spectrum disorder. So these disorders are characterized by problems in social interaction, problems in verbal and non-verbal communication, as well as repetitive behaviors. Intellectual disability is present in some children with autism. Others show average or above average intelligence. Autism spectrum disorders can often be detected in children as early as 1 to 3 years of age. And severe autism spectrum disorder that has its onset in the first 3 years of life and includes deficiencies in social relationships, abnormalities in communication, and restrictive and repetitive and stereotype patterns of behavior. So we have the milder form, which is, of course, most notable symptoms. They are milder non-verbal language problems and restricted range of interests and relationships. Generally, persons have good verbal language skills, though show some of the problems with non-verbal language, as well as you see some restricted range of interest. Just to highlight here, as we come to the end of physical development, when we talked about ADHD, this shows you really the region, the prefrontal cortex, that is associated where children have a delayed peak in the thickness of the cerebral cortex. And you're seeing it based on greater than 2 years delay, and even 0 to 2 years delay. So you could have a look at what the brain really looks like in terms of ADHD when a child has attention deficit hyperactive disorder. I will end this part of the lecture as I'm through with physical development, and then I will proceed to cognitive development in the next part of this lecture.